Hello, I'm Greg Hunt, previously the Health Minister of Australia during the pandemic, and before that Minister for Industry, Innovation and Science, and before that Environment. Currently I have work as a Professor at the University of Melbourne, an Enterprise Professor across the business and medical schools, chairing Monash's Mental Health Institute and commercial work. So I see it in two phases. Firstly, what I've done is taken a 9-month sabbatical, family and fitness and future, those three things, and really actually tried to live that combination. And that's involved a little bit of running, a lot of walking, and actually quite a deal of spin cycle classes with some brutal teachers. Time with my 13-year-old son and my wife and our 17-year-old daughter who's going from year 11 to 12. And then as I go forwards, the future side of it is across one pillar academic, one pillar philanthropic, and one pillar commercial. The academic is, I've been very privileged to have been asked and appointed as a professor at the University of Melbourne, an enterprise professor in the medical schools and business schools. I'm chairing Monash's Mental Health Institute, the Turner Institute for Brain and Mental Health. And then in the commercial world, I'm working across venture capital, advisory work and addressing the question of boards, but not rushing towards the commercial, focusing more on the philanthropic and the academic initially. We're in a strong position with regards to sovereign capability of medical services and medical supplies. Firstly, we're interconnected. And what we found during the pandemic was, even with massive supply shocks, working intensely with departmental task forces every day meant we were able to continue the supply of masks, gloves, gowns, all of these critical supplies of tests and of vaccines. And having one of the highest rates of vaccination in the world at 98%, of producing in Australia, showed that we can both access global markets but provide our own. And we were able to put in place mask production, vaccine production, ventilator production. And so we didn't face the tragedies and the hardships of health systems having to make triage decisions on who lived by having access to care and who didn't have access to ventilators or other care. And that was a profound Australian achievement. So it's strong, but it can be stronger. And that's where the structural platforms of the Medical Research Future Fund, the R&D tax concession, and the patent box approach to medical innovation all come to help build sovereign capability in Australia going forwards. I think there are three big mega trends in health. One is precision health as a service. So in the same way we talk about software as a service, precision health as a service is about making sure that you and I each own our own health data, but we can dig in, we can understand our DNA, our risks, our optimal treatment, our pathways forwards, and that gives us immense power as well as immense capability as individuals. But then as a national health approach, it means that we can provide more data to ensure that there's more targeted coverage. The second thing is stem cells, and stem cell treatment will mean that there's regenerative capacity built over time. That's why we have a $150 million stem cell mission under the Medical Research Future Fund. And then thirdly, genomics and DNA and harnessing that knowledge for targeted diagnoses, targeted treatments and targeted therapies. And this will be the equivalent of vaccines for the coming generation, where there will be profound changes in our individual healthcare treatment off the back of our literal own DNA. Firstly, we have a natural advantage with our extraordinary hospital, medical workforce, research and institutional structures. People want to come here to be part of research and clinical trials in Australia. Secondly, however, we've also put in place foundational bases for investment. By that I'm referring to the Medical Research Future Fund, a $20 billion innovation fund which will be delivering over $650 million a year. Secondly, we have the R&D tax concession, which means that there's a constant incentive, an ongoing incentive for investment in innovation in Australia. And thirdly, we have the patent box for medical innovation, which means a lower tax rate, approximately 17%, for the IP and profits that are generated from intellectual property that is registered and developed here in Australia. So those things give us the additional platform on top of the natural advantage. Now we have challenges, distance, size of market, but as a medical innovator in the selected areas of, I think, precision health as a software, stem cells, DNA, and certain devices, we can be an absolute global leader. It was a real privilege to work with amazing health professionals and to see their work and their dedication. That's the first thing. The second thing is it was an incredible honour and motivating purpose to work with patients. Even in the last few days, I was contacted by a family. Most days I'm still contacted by people looking for help. Contacted by a family where the grandson has a catastrophic and tragic diagnosis of leukodystrophy. I was able to put them in touch with Massimo's Mission, which is a leukodystrophy research, care, treatment and patient guidance mission, which we funded under the Medical Research Future Fund Genomics mission. And they now have a pathway. And to be able to do things like that throughout my time in the health ministry was incredibly powerful, and my staff were motivated by the same goals. At the same time, we were working on the big architecture, and that was in particular reforming the balance between public and private to stabilise private health insurance, which has seen a very significant uptake, to increase the rate of bulk billing from 82.5% to 88.5%, and then to put in place mental health and medical research pillars, including the Medical Research Future Fund. So they were powerful and important, and all of that led to, of course, the work of the pandemic, where through the combined efforts of people right across Australia, what we had was a result which, even though there was hardship, was nevertheless the envy of almost all of the world. Was one of the lowest rates of loss of life, highest rates of vaccination, and highest rates of employment of any OECD country. And all that meant and came together as being lives were saved and lives were protected, and the country was vastly better off. Well, my first message is thank you. Our medical workforce, whether it was our doctors, our heroic nurses, as the son of a nurse and as the husband of a nurse, I'm doubly invested in our nursing workforce. Our pathologists, our pharmacists, the people in aged care, right across the health system, they worked phenomenal hours under immense pressure and they saved lives. So the first thing is thank you. The second thing is I am fundamentally optimistic. Health is hard. Every day there are challenges, and sometimes people think, oh, there's a new challenge, therefore there must have been a failure. No, the bow wave of history is always moving forwards. And against that background, what that means is that we are well prepared. I'm fundamentally optimistic. We have amazing people. The quality of our training, the quality of our graduates, the quality of our senior workforce is the equal of any in the world. I have no doubt about that, and I've had that feedback from health ministers and others right around the world. The second thing is that that training is backed up by very strong institutions. The Australian hybrid model, public and private, is, to my mind, for Australia, certainly superior to the nationalised model in the UK and parts of Europe, and to the privatised model in the US. It's a very balanced model, and so maintaining and retaining private health insurance and its viability was one of the sort of non-glamorous but immensely important things that we did to see an uptake of over 500,000 people come into private health insurance. To stabilise it means that in turn we stabilise the private hospitals, and in turn we stabilise the public hospitals. All these things have come together. I think the platform is there because of our extraordinarily dedicated and skilled medical workforce, our researchers, but now our much stronger ties between innovation and commercialisation for Australia not to be just an extraordinary place for medical treatment, but for medical research, innovation, commercialisation, and that ultimately strengthens the healthcare of Australians and the attraction of the system for our medical professionals. I want to thank them and honour them and wish them all of the best.